In a situation like where we exist, how is it possible not to experience stress, whoever the individual is? Before we even talk about medical colleagues, how can anybody be unfazed in a pandemic as significant as the one that we are experiencing right now? Each home, directly or indirectly, stands affected. There is a realistic anxiety about the illness. There is a realistic anxiety about the uncertainty of the future. There is an ongoing crisis about the pressure that the healthcare provider community is facing, given the extent of the illness, both at an infrastructural level as well as at a personnel level. We are all going through a significant stress. So, even to ask ourselves, is there stress or not, in itself seems almost like a given. In a crisis, stress is human. It's not possible not to experience stress. In fact, if one is not having stress, then there are more likely of an individual having more problems in the future because whilst having stress, we could recognize it and we didn't do much about it. I'm told that most of the people here in the audience come from the medical fraternity. So, as far as the medical fraternity is concerned, what can one say? Um, Exceptional, um, with as much as humility that one can gather and gratitude that one should have. It's quite something, isn't it? The way the medical fraternity right now is serving in this fight, it's just remarkable. Going to hospitals, going through this crisis, coming back home. It's an infectious illness at the end of the day. Going through the mortality, the morbidity, the pressure, the backlash, virtually the sleep awake pattern, personal life, day to day routines, everything is gone. Constantly on the phone or seeing patients, constantly texting and replying, giving advice. The pressure is immense. So, before we even talk in terms of management, we need to first accept it and ensure that all of us keep supporting each other during these times of crisis. I think that's the key. In a crisis which is as the way it is manifested right now, the key component is how connected we are and how much we do things for each other. So if you are a doctor in the emergency or a doctor in the ICU, you don't need me to tell you what to do. You just need me um, to be responsible. You need me and everybody in the society to take care of COVID appropriate protocols. You want and need me not to panic and support you as you fight. But at the same time, if you are my colleague and we are both doing emergency duties, you and I need to take care of each other. Keep talking to each other every time you get a moment. Keep snatching of 15 seconds here and there to take a break. If you are struggling, unmute yourself, talk to someone. Don't bottle it up. Don't let it stay within. I'm not going to advise you about food, about sleep, and other things. In a stand like crisis, warriors that one are, what can one do except doing what we are doing? But yes, there would be concerns about burnout. Yes, they'll be concerned about an aftermath, given the kind of lifestyle uh, the medical fraternity is going through right now. What we will do later on would be later on. What we can do now is recognize that this is not our doing, this is not in our control. We are in our control. We can do the best we can. Each patient that comes to me, I'll treat them with my capabilities. Each family that comes to me, I'll deal them with the patients that I have. Whatever infrastructure I have, I'll use to the best of my ability. With sensitivity and compassion, I do what I should be doing. That's the best we can do. But if my beds are occupied, if I don't have a supply, and then if I'm having to ask someone to go to some other place because right now I don't have the bandwidth, whether infrastructural or in any other way, you don't get guilty over it. Because if you get guilty, then you feel down. If you feel down, you won't be able to take care of the people you're already taking care of. So I'm not saying indulge in self care time because I know there isn't any available right now. But yes, don't allow self criticism to get the better of you because there should not be negativity inside you. Situation is not in our control. That's an absolute truth. And we do not know how things are going to shape up is also the truth. So don't fight what's not in your control. Fight what is in your control. And camaraderie, togetherness, connectedness, communication, compassion, care. These are the tools that you and I have, which we need to work together with each other to ensure that we take care of each other because that's our best case scenario. And yes, when you go home, you will go home after a very, very pressure day. And even at home, phones may not leave you alone, but you still see if you can spend some quality. Right now, quality, even if it comes in bits and pieces, with your family and friends in some way, that you are able to find that little unwinding time, a little bit of mindfulness, a little bit of care of your physical and mental well being, so that the next day when you go, you can go as fresh within the limits that you can. And to the question of how do we deal with a burnout in the future, I think that's where healthcare providers and everybody has a role to play. We need to redefine the way we've looked at frontline healthcare workers. We need to redefine the kind of approach that we have. And we will need to understand that we've always had an infrastructure which could have struggled given the mammoth task that it has on its hand. So now we prepare for the future. And once so the infrastructure prepares for a future, but individuals need to then take a break once this tide is over. You take a break, you indulge in self care, you indulge in giving time to yourself, you know, use the rostering in a way, and all healthcare providers get more resources. So the resources who've put in so much of time are able to take a few steps back so that the system continues, but these people who've been in the thick of things are taken care of. We will all need to come out with a compassion and also have a perspective of the future because we are here because probably we were not very good with looking at future. We are always so tied up in the present like we are now. Right now, what are we thinking about? Beds, oxygen, ventilators, so on and so forth. Once this phase is over, do we continue to improvise our infrastructure and our approach, our policies at an individual, societal, community, healthcare level, at all levels, government levels? At all levels, we need to look at. But again, some of those things are not going to be in our control. And one of the most basic things of managing stress is internal and external locus. What's in my control, I do the best in it. What's not in my control, I accept that I can't do something about it. That's the approach that you need to have. I've been talking a lot to colleagues in medicine right now, and the one thing I'm encouraging everybody to do and asking all of you to do, please keep talking. Don't bottle it up. If you are experiencing grief, share. If you are experiencing guilt, share. If you are experiencing frustration, share. If you had a horrible day because you saw things that you didn't ever thought you'll see, share. Because our solution right now is doing what we can do at 100% and being together also 100% so that in this situation that we find ourselves, we are able to come out of it by taking care of each other. because we'll have limited abilities to take care of our own selves only because we have limited time available, and we are stretched thin beyond limits. There is no point giving tips and things that okay, do 1 2 3 4 5, and you will tell me, but where is the time? And that's why the right approach is to accept we are in difficult times. We are all under stress. We are under tremendous pressure. And the only way to release the pressure right now, no self blame and a lot of communication. You do that, whatever little family time, friends time that you get, whatever you are able to take rest, do that. Let's get on the other side of this wave first. And then we redefine our approach. And yes, healthcare providers also, once we're out of this, remember communication matters, messaging matters. All of us need to communicate and make sure that the social conversations and dialogues happening in the world, in the social media space and other spaces, medical dialogues are governed by medical experts so that non medical experts don't create unnecessary panic and false narratives because that hurts everybody's well being. So this is what I wanted to say. I didn't want to, go on a monologue for long. Let's have a conversation. It's as much that you speak and I speak and we talk to each other rather than only me speaking and you listening. Um, Whatever is your format, I'm not too aware of it. If you are going to speak a question or a comment or a suggestion, please do that. If you're going to type it, feel free to type it. I'll go through each one of them and answer.
Oh, please type any questions you have in the chat box, or you can directly send the question to the presenter.
Whichever you prefer, feel free, please. How to deal with this infrastructure insufficiencies? I mean, Not in my control.
coming,
Not in my
I mean,
As in if I am a doctor in a hospital which had 15 beds and I had maybe four ICU beds and the 15 beds, what can I do? I can probably make the 15 into 20, make single occupancy into maybe double based on the size, but I can't go beyond my capacity because I will neither be able to take care of those whom I can and trying to take care of more. What is not in my control is not in my control. And as a doctor, I just need to do my best, which I can do with what I have. I mean, if let's say you had only one syringe, and if you have 10 people to give that syringe to, you'll be able to do it with only one person. Now, one person that you took care of and you couldn't of nine was not your fault. There was only one syringe. Just don't take self blame. Don't let any self blame happen here.
how do I handle anxiety while I'm in isolation or being officially quarantined?
I am quarantined officially in my 14th day actually. Um, I continue to work. To be honest, I also gave myself some time in between. I split my day into work time and non work time. Found some time to read and listen to music as well. Made sure I connected with a lot of people, did a lot of video calls, a lot of calls, and made me feel good and made others feel good as well. In fact, I probably talked to some friends and family members for this long, this regularly after a very long time, because typically there wasn't the time. So yeah, you create that balance and do that. But anxiety is natural. Throughout this time, it's been an anxious last 14, 15 days. Um, the next cough, the thing that are you having fever, or if in the next room my parents are showing signs or not, and that's anxiety is natural, it's normal, it's human, we're all humans. We will struggle when there is a problem, but you do what you can do the best.